Hi, my name is Dawn Wing. This is my VTC physical assessment video. I'm going to have my patient read his consent.
Hi, I'm Scott Wing. For the purposes of education, I agree to be assessed in this VTC video and have it posted on YouTube. You have my consent.
So, Scott, it's my understanding you are here today for a physical assessment due to having a new job.
Yes.
Where are you working?
Revision Military.
So, could you tell me a little bit about what that job will entail for you? How many hours is it a day?
That's a little over 12 hours a day. I'll be on my feet most of those 12 hours.
How many days a week?
Right now, 4 to 5 days a week.
Okay. Any crouching that's required?
Yeah, there's bending and crouching, lifting 50 pounds, a little bit less.
Is vision acuity an important part of this job?
Well, some of it, I guess.
Okay. So I think it'd be important if we tested your vision as well while we
Yes.
have you here.
Yeah.
Trying to think, is there any specific thing about your job that they're wondering if you're capable of doing? Physically.
Oh, no.
Okay. So we'll go ahead and start with the physical assessment. So Mr. Wing, I did watch you walk in and it seemed that you have a good symmetrical walk. Are you having any problems walking?
No.
Okay, great. Is there any concerns that you have about your physical ability to perform this job?
Just my shoulder kind of bothered me.
And from your paperwork, it looks like that's your right shoulder?
Yes.
Okay, so we'll be talking about that as well. Just while I'm watching you talk, it seems that you have good conversational hearing.
Yep.
You are articulate. Can you tell us your age?
46.
So he appears to be his stated age, maybe a little bit younger appearing than his chronological age. Definitely not, oh my gosh, this looks like a 70-year-old man saying he's 46. So that's good. Good job, Mr. Wing. If I could just I'm going to assess his facial nerves. Well, first I probably should start with the top of your head. Go ahead and just take a seat. I'm just going to feel the top of your head. I don't feel any abnormalities, no lumps or bumps. Does anything hurt when I'm touching you?
No.
Okay. Looking at your ears, they appear to be normal on the outside. The pinna seems to be normal. I don't see any abnormalities. He doesn't have any outer ear abnormalities. I'm going to take a peek inside your ears. I pull back on the pinna and I look down. If I dock my stuffing tool. Great. Looks good. No signs of ear infection. No signs of otitis media. Looks wonderful. So, Mr. Wing, I'd like to assess your facial movement. Can you smile for me? Excellent. Can you stick out your tongue? And that is symmetrical as well, so that's a good thing. I'm also going to have you look at my fingers, and I'm going to test your visual acuity in one way, and also your cranial nerve number 3 and your eye movement. So you tell me when I should probably stand behind you. You tell me when you see my fingers.
Yep.
Okay, without moving your head.
Yeah.
Okay, that's good. That's actually a normal finding. And I'm going to try to do it lower. Don't move your eyes.
Yeah.
Okay.
Oh,
I'll try to do it higher.
Yeah.
Okay, now I will have you move your eyes. Can you move your eyes to this finger? Excellent. Can you move your eyes to this finger? Can you move your eyes above? Can you move your eyes below? Your cranial nerve number 3 appears to be working excellent. And since he's been able to speak to me, nerve 7 are working as well. I'm going to feel his sinuses. Is there any pain or pressure when I push on you?
No.
Okay, great. I'm going to assess the lymph nodes in your neck. Any recent coughs, colds, or illnesses?
I had a little cough.
How long ago was that?
It's still going on.
I don't feel any lymphedema or swollen lymph nodes on this side. I'm going to assess this side. Wonderful. I don't feel any. I'm going to have you lift your arms I'm going to feel for lymph nodes under here. I'm not feeling any swelling. I'm feeling your chest. Any chest pain recently?
No.
Any chest, you can put your arms down, sir. Any chest pain with exertion?
No.
Okay. I'm going to listen to your lungs. I'm going to go ahead and have you take your shirt off if that's okay. Do you feel comfortable doing that? I won't look.
Yeah, that's fine.
And just for the record, I did wash my hands prior to entering the room with Mr. Wing, and so they are clean. My stethoscope has been disinfected as well. So. I'm going to have you take a deep breath in and out. Excellent. Again. Perfect. Again. Excellent. Last time. Wonderful. So this time I want you to speak. Say E.
E.
Excellent. Do that again.
E.
Do that again.
E. E.
So you appear to have a clear lung field. Your respirations appear to be without labor, meaning it seems to me that you're having no shortness of breath while you're sitting here and talking to me. Is that as?
Yeah.
Okay. What about walking upstairs? Can you walk up a flight of stairs without getting short of breath?
Yes, I can.
Can you walk up 2 flights of stairs without getting short of breath?
Yeah.
3 flights of stairs?
Well, maybe.
That's a normal finding. Excellent. So the next thing I'm going to do, since I have you sitting here, is just look at your skin. I don't see any abnormalities. Everything seems to be normal. I will note that he does have tattoos. One there, one there. This looks like a wizard. This looks like Yosemite Sam. You appear to have a sun and a name. Your back seems to be symmetrical. You do appear to have a scar on your lower lumbar region. Can you tell me what happened there?
I had a herniated disc when I was 16 and I had surgery.
Do you still have back pain?
Yeah, once in a while. If I sit for a long period of time or if I stand for a long period of time sometimes.
But this job that you have will not require that?
No, it doesn't.
So you feel you can perform this job?
Yeah.
I'm going to have you stand up, sir. And I'm going to have you kind of like a sobriety test. Can you shut your eyes, touch your finger to your nose one at a time and then back. Perfect. Do the other hand. Excellent. You can open your eyes now. Good. Since we've had back issues, I would like to see if you can touch your toes. Any pain or problems doing that?
No.
Okay, come up, sir. You did excellent. Good job.
Thank you.
Okay, I'll have you take a seat again. I would like to test your strength in your hands. If you could squeeze my hands, squeeze, 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 squeeze. Excellent. Now I'm going to try to pull your hands up. Don't let me. Excellent. Good strength. I'm going to try to push your hands down. Don't let me. Excellent. Put your arms out to your side. I'm going to try to bring this hand in. Don't let me. Good. I'm going to try to bring this hand in. Don't let me. Excellent. Same thing with your knees. I'm going to try to keep your knee down. Don't let me. Yes. Good strength. Same thing. Excellent. Foot pedals, just like you're pressing on the gas. Go ahead. Excellent. Wonderful. And we'll do it the other way too. Good job. Great. So because this job requires crouching, can you do this, please?
Asking a lot.
Can you come back up without touching anything? Did it go okay?
Yeah.
So your back seems to be working okay. The only thing that I worry about is the repetitiveness. Will you be having a lot of repetitiveness of this?
No.
Okay. So do you feel you'll be okay?
Yeah, I'll be all right.
Wonderful. All right. I'll have you take a seat. Excellent. So I'm just going to refer to my notes. And so you've been complaining of decreased bowel activity, constipation. How long? And you may put your shirt on again, sir.
So when was the last time you had a bowel movement?
Yesterday afternoon.
And what's a normal bowel movement for you?
With or without laxative.
Yes, it does say that you've been taking Bisacodyl, 10 milligrams, which is 2 of those pills, once a day,
Yep.
Nightly. And is that enough to have you have a regular bowel movement?
Sometimes. It all depends on what I'm eating.
Oh, so you have been able to sense if you increase the fiber in your diet, that works.
That and vegetables, yeah.
Vegetables contain fiber, so that's good. Wonderful. So about how often do you have a bowel movement? Would you say daily?
With laxative?
Yes.
4.
4 times a week?
3 or 4 times a day.
Oh, so maybe you actually do not need the laxatives.
Well, maybe not. If I don't, then I gotta push really hard.
Okay.
And
it hurts. So it sounds like maybe constipation is not your issue, but actually the consistency of your stool. So literature suggests really either going with a stool softener or increasing the fluid in your diet. So non-caffeinated fluids, so increasing waters, unsweetened teas. Well, that has caffeine. Unsweetened decaffeinated teas. Is that something that you think you could try? You might actually be able to eliminate the Bisacodyl.
Yeah, you can do that.
Yeah, it sounds like if you're going 4 times a day, that maybe that could either be normal for you. Now, what is the consistency of your stool when you do take the Bisacodyl?
It's a liquid mostly.
Yeah, that sounds like maybe you actually do not need the Bisacodyl. You just need to increase the fluid that you're taking in that's non-caffeinated. How much do you drink a day?
I've been drinking a lot of soda since working in since
You started work at Revision.
Yeah.
How long ago was that?
a month ago.
Okay. And the soda that you drink, is it mainly caffeinated?
Oh, yeah.
So I think we found the problem. Could you try just to eliminate the caffeinated beverages and to increase your amount of water in your diet?
Yeah, they have a water fountain there. I can do that.
Do you need a water bottle?
No, I have one.
Okay.
They gave me one.
Wonderful. They gave you one. Even better. Excellent. Okay. So I would try that, and that is actually a much better idea than going 4 times a day of loose stool, because you could decrease your electrolytes and make those off balance by doing that. Is this your son?
Yes, he is.
Do you agree to be filmed for educational purposes?
Yeah. I
Okay. So the other thing I have on here, sir, is that you have right shoulder stiffness and pain.
Yes.
On a scale of 1 to 10, 10 being the worst pain you've ever had, 10 being the worst pain you've ever had, 0 being no pain at all. What would you rate your right shoulder pain? Yeah.
Right now, there's no pain, but when it
Stop
does come on,
talking
it's
about
probably
that.
2 or 3.
Hey, stop. I said
2 or 3, but I show that intermittently it has been about a 5 when you're playing baseball.
Yeah, when I'm pitching.
So you're on a men's baseball league.
Yeah.
How often do you play?
In the summer, every Sunday.
Do you also have practices?
Yeah, we have practices once a week, usually on Fridays.
Does your wife mind you going to practice
Mommy,
on
what's this?
Friday nights?
Yes, she does mind.
Mommy,
We go to
what?
practice on
Mommy,
Friday
Mommy,
night.
what's this?
When that could be a night that you spend with your
Mommy,
family.
Mommy, what's this?
But pretty much,
Give me back, give me a back.
so the men's baseball league during the summer is all summer long every Sunday.
Yes.
Okay. And how long?
Except for Mother's Day.
And how,
Mommy, we go to the baseball game.
I know, we like to do that, don't we?
Yeah.
How long are your games?
Usually a couple hours. 2
I
2.5
don't
hours.
need
Are they played outside?
Yes.
Do you wear sunscreen?
No.
You need to wear sunscreen.
Boo!
What time of the day are your games played?
Noon.
So, summertime, outside, noon to about 3 is the time when the sun is the brightest and can have the most damage to your skin. And in order to avoid melanoma, which is cancer and it can be fatal, you definitely want to make sure you're putting sunscreen on your ears, on your face, even the spray kind in your hair. You want to make sure that any exposed body parts are covered in sunscreen. Okay, I did take a peek and I don't see any lesions on you now, but you know, that is a concern, and so that is a practice that you probably should incorporate is sunscreen about a half hour before you go out, and then reapply during your game if you become sweaty or you notice that you're you know, rubbing it off for some reason. So when you say you have that shoulder pain and you're pitching, are you pitching for the entire 3 hours?
Usually, it all depends if they're hitting the ball or not.
Has your pain ever made it so you couldn't pitch? Somebody had to come in for you?
Once last year, when I first started, I just barely started pitching, so it was the first couple of games that I did pitch. Somebody else had to leave me, but it was a little sore. But
So I would like to see your range of motion. Can you, with both arms actually? Excellent. That looks great. Was there pain doing that?
a little bit.
Okay. And where was the pain?
My shoulders, right in here.
Mommy, I went under your chair.
Thank you. With what motion was the pain the worst?
Backwards. Yeah. Which is the way, you know, you bring out.
Is that how you pitch?
Yeah, you come to.
So is pitching an important thing for you, or do you think you could switch to a different
I could
position?
switch to a different position. I like pitching.
So mentally, it's an important job for you.
Yeah.
Are you good?
Yeah.
How many years have you been pitching?
Well, I didn't start this league. I pitched all through Little League, so 9 years old, 10, 11, 12. Probably 10 years then, and then I haven't pitched in 20 plus years, so it's been a while. And this is my first year in 20 plus years I pitched. So.
Congratulations. So 46 years old, still playing sports.
Yeah.
That's great. So it keeps you active.
Yeah.
Wonderful. What are you allergic to?
Steroid. Prednisone? No, I don't know.
Steroids,
Yeah,
prednisone.
prednisone.
What happens when you take prednisone?
I don't know, for some reason from here up, I turn red.
I also show from your medical notes that you get hives, which is the turning red, but you also get tachycardia, fast heart rate. Is that true?
Mommy,
Oh, I
Mommy,
never said anything.
Mommy,
Your medical notes say you
Mommy, I want
Okay.
that.
Where you feel like your heart's racing?
Oh, probably.
Okay. So what medications do you take daily? And actually, I show you taking Paxil, Bisacodyl, glucosamine, and Tylenol. So the Paxil, 80 milligrams oral daily.
Yep.
When was the last time you took that?
About an hour ago.
Okay, so you take it at night?
Yes.
Wonderful. What are you taking that for?
My depression, anxiety.
How's that going?
Going good. Seems to help.
Do you see a counselor?
No.
Do you feel you need to be referred to a counselor?
Mommy, what's it?
Okay. So, when did you start taking Paxil?
No, Mommy, I change it. I have two.
2005, I guess, after my first divorce.
How many divorces have you had?
Just one.
Whoa, I had that right.
So are you currently married?
Yes.
Are you happily married?
I am happy.
I'll pretend I didn't hear. Go ahead, answer honestly.
Yes, I'm happily married.
So, do you feel you still need the Paxil?
Yes and no. Sometimes I do.
What happens to trigger your depression or anxiety?
Money. I'm worried about money.
So,
Paying bills.
So probably with this new job, that might.
That might help it out a little bit.
Yeah.
Maybe I can wean myself off in it. Let's just see.
Are there any coping mechanisms you've put in place for when you feel like you're suffering from anxiety and depression?
No. Well, I usually go for a walk.
And that helps.
Yeah, that helps a lot.
Awesome. That is a healthy way to deal with it. Okay, so I also show you taking 10 milligrams of bisacodyl daily as needed for constipation, and we've talked about that. Glucosamine chondroitin, 1 to 2 tablets nightly as needed for joint stiffness. When did you start taking those?
About a year ago.
Are they helping?
Yes.
Really?
I believe in them.
You believe in glucosamine chondroitin?
Yes, I do. It's helped my knee and my shoulder. I still get pain in my shoulder and my knee, but I'll tell you what, it works.
I actually don't show that you mentioned anything about knee pain, so let's go ahead and assess that. So what's going on with your knee?
I don't know, I just had problems with it forever.
Past 10 years.
Which knee is it?
My right knee.
Right knee. Let's look at the motion of that knee. Can you show me your range of motion on that?
Well, it's a lot better than it used to be.
Does it hurt when you do that?
Not anymore.
Okay. I also would like you to pull up your pants and let's look at that joint. That looks to be, let's look at the other one as well. So they appear to be bilaterally normal. I'm not feeling any warmth. I'm not seeing any redness or swelling. Any pain behind your calf? Put your foot up. Any pain behind your calf when you do that?
No.
Put this foot up. Any pain behind your calf when you do that?
No.
Release them. Great. Okay. Wonderful. Tylenol, 500 milligrams oral, 2 tablets as needed for pain or fever. When was the last time you took those?
About 4 hours ago,
And the reason?
I had a headache.
Yeah, I see that you've had some head injuries. Head injury times 3, all related to playing baseball, history of fracture.
Softball.
Oh, softball, not baseball.
I haven't been hurt in baseball.
How many years did you play softball?
Oh my goodness. 2 years ago, 3 years ago. What's that? 43.
Give it
I don't know, 30 years. Probably.
Played for 30 years.
Yeah,
So about every 10 years you get a head injury.
I guess so.
All in the same spot or different spots? Or?
2 were in the same spot,
Where was that?
right here. Well, I hit my head here on a railing and got a concussion there. And then 5 months later, I got hit with a softball right here. Broke 3 bones in my face. And then 3 years later, I broke my nose.
Oh my goodness. So, do you still play softball?
No,
And the reason?
because I want to keep my face.
So we've already assessed for eye entrapment, and it doesn't seem like those injuries are actually having any issues with eye entrapment. I have already assessed for his pupil size, and they are perla. They are bilaterally. His pupil size are reactive to light. They're normal size, and they react bilaterally at the same time. So that's good. So it doesn't seem like you're having any issues with that. I do think it probably would be important for you just to have a referral to an orthopedic surgeon, not necessarily to do surgery, but maybe for you and him to, or her, if it's a female, to chat about your shoulder issues, and maybe they can suggest ways to decrease the pain that you're having. Does that sound like something you'd be interested in?
Yeah.
Okay. And we've already discussed the back pain that you've had from the football injury. You were 16?
Yeah.
Okay. So there are some questions that we like to ask when someone is depressed. In the last week, how many times have you felt hopeless?
0.
Okay. In the last week, how many times have you not felt pleasure in things that you normally find pleasure in?
0.
Okay. In the last week, how many times have you felt like hurting yourself or others?
0.
Okay. So you don't feel homicidal or suicidal
No.
at this time? Okay. Well, that's good. If that changes, then it would be really important for you to reach out to a crisis cancer. I will give you that number before you leave here.
Okay.
So as far as surgeries go, it shows that you've had that laminectomy of your back in 1986, that you've had a ganglion cyst removed from your foot in 2013.
Yes.
Which foot was that?
My left one.
And do you have any issues with this foot now?
Oh yeah, it's all numb still.
Who is that? Who is that, Molly? Hello? Where are you? Okay, hold on. Did you bring up the papers from the car?
Okay.
Okay. Well, you're going to have to tell her no, we don't have it. They're in the car. Okay. So, there's one thing on here, sir, that I see that could be a little bit of a concern. It looks like tobacco use.
Yes.
So do you smoke?
No. Chew tobacco.
Have you ever smoked?
No.
Okay. And about how much tobacco do you chew in a day?
Maybe a can.
Okay. I see that you've never smoked.
No.
How many years?
Have I been chewing?
I show 25 years. Is that if I said that?
It's more than that. It was 13. So it's probably been 33 years.
Oh, okay. Your medical record shows 25.
Oh, okay.
So, but it's 33. Is that something we could help you with? Because I don't know if you know this, but chewing tobacco actually is a leading cause of mouth cancer in males.
Yeah.
And there is some cancer in your family, is that right?
Yes.
Who had cancer? It's my understanding that your maternal grandmother
Yes.
passed away from colon cancer at a very young age.
Yeah. I don't even remember. I was little. Well, I don't even know.
Wasn't it your parents' wedding day?
Yeah, it was my parents' wedding day. So.
You weren't born, I'm assuming.
Shortly after.
Oh, really?
Yeah.
Wow. That's a scandal. No, I'm kidding. Okay. Have you had your flu shot this year?
Not yet.
Are you planning on having your flu shot?
Yes.
Do you have an appointment to have your flu shot?
Not yet.
I would like to give that to you before you leave here today.
Okay.
Do you have any allergies to eggs?
No.
You said that you had a little bit of a cough.
Yeah.
I took your vital signs and I did not notice a fever. Have you noticed a fever?
No.
Okay. So you are agreeable to the flu shot?
Yes.
We will get that before you leave today. Have you ever had a pneumovax?
No.
Okay. Tetanus. It looks to me like you had your last tetanus booster when you broke your nose in 2013?
Yeah.
Okay. So that would be current. You don't need that. It actually, your notes here say that the reason that you got the tetanus booster was for the pertussis protection, and the 2013 was when you had your last child, and so you were protecting the baby from whooping cough. Does that sound right?
Yeah.
Okay. As a child, did you receive vaccinations?
Yes.
So you feel that you're up to date on your vaccinations other than the flu shot?
Right.
Okay. Cardiac history. Any history of a family member passing away from cardiac issues?
And then I know
Heart. Cardiac means heart.
my uncle, my dad's brother, Richard.
What was he doing?
I have no idea.
Was he working strenuously?
He might have been.
No!
He was way overweight.
At work.
And then my
She's
other
not at
uncle
work. She's doing a video for YouTube for work.
heart,
So why?
and
Don't
then
call
my
back again.
21-year-old cousin got up one day and he dropped dead right there on the floor of his heart.
I do show 21-year-old first maternal cousin collapsed and died of unknown cardiac issue.
And his father died 2 years before that. The same thing.
His father was not your relative. It was
No.
his mother, right? This was your maternal
Yeah.
cousin?
Right.
Okay. Your notes also say that your maternal grandmother had colon cancer diagnosed at age 39 and passed away in her mid-40s. Does that sound right?
Yes.
Suicides in your family.
No.
Do you ever feel suicidal? Thyroid cancer. Any thyroid issues? If you're going to do that, okay, I'm going to feel your thyroid. Your thyroid is right here. No crepitus, no enlargement. Wonderful. Okay. Tell me your birthday.
9/28/70.
And where were you born?
Hartford, Connecticut.
Your typical diet?
I try to eat healthy.
Right.
Of what you're eating, what would you say? Is it just that? Because your BMI is 34. I'm sure you're aware that over 30 is overweight.
Right.
29 and over is overweight, actually. So you could stand to lose a few pounds.
Oh, yeah.
Have you been told that before in physical examinations?
Yes.
Okay. But today, that's not what we're looking at. We're looking at to see if you're physically fit for this job. Okay. But I would encourage you, it looks like your diet consists of a lot of carbohydrate snacks, but also veggies, fish, and chicken.
Yes.
I would encourage you to try to decrease the amount of carbohydrates that you're eating and increase the amount of vegetables that you have in your diet. So carbohydrates would be breads, would also be potatoes, corn, those kind of starchy things, crackers, cereals. Yeah, try to decrease that and increase. Substance abuse. Do you use any illicit drugs?
No.
Have you ever had a problem using drugs?
No.
What about alcohol?
I have an occasional beer in there, but
On average, how many alcoholic beverages would you say you average in a week?
0 to maybe 1.
You filled out this form and you said 4
Oh,
a
okay.
week. Is that because certain times of the year you have a little bit more than others?
Yeah, sometimes.
Is summer when you're...
Summer's the worst.
Yeah. Try to increase that water intake. Do you ever feel like your alcohol use is affecting others?
Nope.
Do you feel like you have a problem with alcohol?
Nope.
So you don't feel like you need to be referred for counseling?
No.
Okay. What's the last grade you completed in school?
12.
Okay, so you have a high school degree?
Yes, I do.
Diploma, rather?
Diploma.
Any college?
No.
Any trade school?
No.
Does this job require college or trade school?
No.
Can you read and write?
Yes.
Exercise. How many times a week would you say you exercise? Mitchell, can you
4.
please turn that off?
5.
Mitchell, go in another room or turn that off.
Try to walk every day, but since I started this new job, I haven't been out. Plus, it's been cold.
Do you get to walk during your day?
Oh, yeah, I'm walking all the time.
Okay. And when you do go for exercise walks, how long are you out on those walks?
An hour.
Okay. Family situation. Who lives with you?
My wife, 10 years. My daughter, Marley, 7 years. My son, Mitchell, 3 years. And my stepdaughter, Sierra, 15 years. 16 years.
No, 16.
You haven't lived with her for 16
No,
years.
I
She
haven't lived
is
with her
16.
16 years. I lived with her probably 10 years now.
Support system. It's my understanding that you have an aunt that lives nearby that
Yes.
seems to be a support system for you. Who else?
My wife.
Oh, I mean outside of your family.
I got a
Outside of
friend.
your immediate family.
Got a friend.
Do you have a brother that lives nearby?
Yeah, my brother.
Do you have any nieces or nephews?
I have one nephew and one nephew.
And one niece.
One niece.
Are you pretty close with your brother?
Yes, very cool.
What hobbies do you enjoy?
So anything to do with sports. I like golfing. I like baseball. football, hockey, anything.
So when you say you like them, does that mean watching them or actually playing?
Playing and watching.
Alrighty. It's my understanding that you actually won a golf tournament this summer.
Yes, we did. As a family. Thanks to my brother.
Rude. The Wings took number 1 in the Newport Family Golf Tournament. That's wonderful. I wanted to look at your skin. So if we could look at your skin. Let me actually sit there. I want to look at the bottom of your feet. So it appears that you have a dry patch on the bottom of this foot, about 2.5 centimeters by 2.5 centimeters. Any issues with that?
No.
Have you tried lotion?
Tried lotion, tried everything.
How often do you lotion your feet?
Maybe once a week.
Okay, so maybe you could try to do that every night before bed.
All right.
Okay, let's look at this one. And I'm noticing that same dry patch right here. However, the other thing I'm noticing looks like it's congenital. Looks like you have webbed toes.
I do.
Hey, Mommy.
Any issues with walking?
I want to do
Okay,
mine.
let's look at this. So webbed toes as well on this.
Mommy.
So the only thing I'm really looking at, any pain when I push on your feet?
Mommy.
Okay.
Mommy.
The only thing I could really say is you walk fine. You've never had issues with this congenital deformity. Abnormality, right? Not
I swim
deformity.
well.
You swim well. Okay. That's great. You can put your feet down. Let's look at the back of your legs again. So I notice you have some bruising on your shins. You've been bumping into
Mommy,
stuff.
All this stuff that hits me.
Mom.
I dropped a helmet. Wood.
Oh, I found another tattoo.
Mom.
Looks like a sun. Yes.
Mom.
Yes.
Mom.
And I noticed that you have no dry skin and that your toes are not webbed. Yep, no dry skin, and you don't have webbed toes either. Do any of your children have your webbed toes?
No.
Yeah. Right there.
You do not have webbed toes.
I want to do my legs.
Okay, so I would like to look at the skin on your legs. Those look good. I don't see any abnormalities. Wonderful. We will continue on then. So your skin assessment, I had already looked at your back and your chest. We've looked at your legs. That all looks fine. Your right eye is a little bit sunken in, but you don't appear to have any eye entrapment. Do you feel that that is from the injuries that you've had as a result of softball?
Yeah.
Okay. Have you seen a physician for those? For that eye being sunken in?
Sunken in now. I mean, sunken in.
I thought you had a CT scan of your head,
Oh, I did, but
and they thought that it was okay.
yeah.
Okay. How often do you have headaches?
Quite a bit.
I show that occasionally. That you had broken facial bones?
Well, lately it's been more than occasionally, but I think it's lack of sleep.
Okay. Do you think the lack of sleep is, like you said, you've recently increased your caffeine uptake?
Yeah, probably. I do drink
Okay.
a lot of caffeine.
So I think we should also refer you to a neurologist for the headaches. Would you be okay for that?
Yep.
Okay. So we will do that as well. So far we're going to refer you to a orthopedic surgeon and a neurologist. We've looked at your ears. That looks normal. Any abnormal drainage coming from your nose?
No.
Okay, good. I see none. Your throat, are you able to swallow okay?
Yep.
Your neck, let's see you do range of motion on your neck. Okay, to the side, kind of do a circle. Any issues when you do that?
No.
Wonderful. Your pecs, let's look at your pecs again.
Shirt off?
Well, just up. Any issues?
No.
So it is possible for men to get breast cancer, believe it or not. So you really should be doing a self-breast exam, maybe in the shower, just to assess for that. And if you ever found a lump, you would definitely want to let your primary care physician know. The other thing you should do is look for drainage. Just squeeze and look for drainage. I don't see any,
Hey,
but that is an important thing in health.
please.
Respiratory. Deep breath in and out. Do you feel like you needed to cough when you did that?
Nope.
Okay.
But it's also free. Oh, that's just.
And we've already talked about you don't feel short of breath
Right.
abnormally. Can you lay flat?
Yeah.
No issues when you lay flat?
No.
Okay. Gastrointestinal. Any issues with that? Your stomach.
I had, I don't even know how old I was.
One.
I don't know.
Oh,
They stuck a camera up
7.
there and took out some biops or whatever. Took out,
You had an EGD,
yeah,
and they took out some biopsies.
yeah,
Did they find anything?
no.
And the reason for that, sir? Bless you.
Because of my ulcers. Does that sound right?
You had an ulcer.
Yeah.
Okay. What year was that?
Oh my goodness. 22 probably. So whatever. How long ago that was that?
24 years ago.
Yeah.
Okay. And how did you know to get treatment for an ulcer? What symptoms were you having?
Does everyone want to know?
Yes, we're doing an assessment.
I went to Burlington to a party, and I was drinking beer and I was drinking tequila, and I laid in bed and I couldn't breathe. I felt like I was dying. So I finally got hold of one of my friends there. They called 911, took me in the ambulance, took me to Burlington Fletcher Allen, I guess, or whatever.
University of Vermont Medical Center.
Yeah. And they made me drink this stuff and whatever, and come to find out I had an ulcer. I didn't realize it. So I think it was due to drinking.
So when did they do the EGD? The scope.
Oh, that was years later. That was Myers. That was.
Can you have your son turn off his
Mitchell.
thing
Shut
or go
that
to
down.
another
Go to
room?
the other room, please.
Oh,
You have to.
no.
Then turn it down.
No.
Mommy can't hear me.
I can't hear after
I was
that.
probably.
Speak up louder.
I was probably 25. Marley. Jeez. So.
And what was the
20
reason they
years
did the
ago.
scope? Down your throat?
No, not my butt.
Okay, they did a colonoscopy.
No, they call it a flexible something.
Oh, flexible sigmoid
Yeah.
scope,
Yeah.
like sig. And the reason they did that
I thought it had to do with my ulcer.
in your rectum.
I don't know. Honestly, I don't remember why.
But you know, seriously, sir, you have a history of colon cancer in your family, and you are 46. The recommended age is 50 for colonoscopies, but due to the family history, you probably should talk to your primary care physician and see if you're a candidate for a colonoscopy, an early colonoscopy.
Okay.
All right. Urinary. Any problems with your penis?
No.
Any problems when you pee?
No.
How often do you pee?
Oh, a bunch of times a day.
Too much, or do you think it's a normal amount?
Normal amount.
Okay. Reproductive. Do you feel like your reproductive organs are still working?
Yeah.
No surgeries to make those not work?
No.
Do you do men testicular exams on yourself?
No.
You need to. It's important. So I'm not going to do that here because this has to do with an employment exam. However, you should be touching your scrotal sac and making sure that there's no abnormal. You should know what it feels like normally, and you should know if there's a change. Is that something you think you can incorporate?
Yeah.
Okay. Peripheral vascular. So your feet, do you feel like they've got good blood flow?
Yeah.
Cap refill is less than 3 seconds, so that is good. Wonderful. Let's see your fingers. Does it hurt when you go outside in the cold?
No.
Okay.
Mommy.
So we've already assessed your musculoskeletal, your neurological. Do you have any memory problems?
Yeah. Since
So,
I've been hitting the head,
okay.
short term, long term. I remember sometimes.
Hey, Mommy, I want to take my fingers.
Oh, yes. Wow, your cap refills like less than a second. That's awesome. So again, we're going to be referring you to a neurologist for the headaches. That is something important that you probably should bring up to them as well. Lymph nodes. We have assessed your lymph nodes up here. You should be checking in your groin as well for any abnormal swellings under your armpits. You know, like we talked about your breasts. Those are the things that you should be checking on yourself. And if you notice an abnormality or a new swelling, that's something that you should be calling your primary care physician and having that looked into. Endocrine. Any problems that you know of with your adrenal glands or with your blood sugars or...
No.
Okay. So, sir, just because you are a male who is middle-aged, 46 years old, your BMI is above 30. You should be having that discussion with your primary care physician about maybe checking for diabetes, high cholesterol, those kinds of things. Mental health, I will give you the number to the local mental health facility. Yeah, sure, you too. So that you can have that crisis number. But as of right now, you don't feel like you're having issues with that?
Right.
Okay. So prior to you coming in here, one of the nurses did get your vital signs. Your blood pressure was 110/76. Now, the best way to get vital signs or blood pressure is to be sitting with your feet flat on the ground, not talking, your arm resting. Is that how she took that?
Yes.
Okay. Your heart rate was 60 beats per minute. Apical and regular. Your respirations were 16. Your temp was 36.8. And your oxygen saturation was 98% on room air. Those are all normal findings. So again, we looked at your skin, and the only thing that we found was dry feet bilaterally, about 2.5 centimeters diameter. You do have tattoos. I would suggest no new tattooing.
Okay.
Who did your tattoos? Were they prison tattoos?
No. Professionals.
Did you watch them open the needles?
Yes.
Have you ever been tested for hepatitis C? Or HIV?
No.
That's probably, you have tattoos. That's probably something that you should get tested for. Bless you.
Excuse me.
When was your last tattoo?
Oh my God. Long time ago.
Did you start this out?
2007.
Okay. And was that a professional tattoo person
Yes.
as well? And you've watched everyone that you've had done, you've watched them open the needles? Okay, that's important. But again, you never know. They're not medical professionals. They're tattoo artists. So you probably should ask for an HIV test and hepatitis C, B test. In fact, let's feel your liver. I'm going to have you lay down. Please, sir, lay down.
Watch out, Mitch.
Before we feel anything, I would like to listen to your vowel sounds. I heard sounds there.
I want to do mine.
I heard sounds there.
I want to do mine.
I heard sounds there. So you have positive vowel sounds in all four quadrants. Let's see about you. Oh, that's a sound. Oh, that's a sound. Oh, that's a sound. Oh, that's a sound. Okay. Now, I would like to have permission to feel your stomach.
Sure.
Okay. So first I'm going to have you lift your shirt up. I'm going to go under your rib cage and try to feel the borders of your liver. I do not feel an enlarged liver, so that's good. Any pain when I do that, sir?
No.
Okay, I'm going to try to feel your spleen. I do not feel an enlarged spleen, so that is a normal finding. Any pain when I do that?
No.
Okay. I would like to see if there's any pain. Does it hurt when I push in?
A little bit.
Where does it hurt?
Right here.
Does it hurt when I push in or let go?
Push in.
Okay. So that would not be an appendicitis. Now, it hurts when I push in because why?
Mommy.
Does it hurt when I push in over here?
No,
Does it hurt when I push in over here?
no.
Why
Does it
do
hurt
you
when
do
I
that
push it
like
over here?
Daddy?
So it's just your right lower quadrant on pushing in, not on letting go.
Right.
Okay. So that again should be checked out.
Okay.
I'm going to have you sit up, sir. And I would like to check for your CVA tenderness. So I'm going to be hitting your back.
Okay.
You let me know if you feel any pain. I am hitting the back of his back. Are you feeling any pain?
No.
Okay. Great. Wonderful. All right. Let's continue. I would it was the way you were
I
laying.
think so.
Well, how about you lay on the
Mommy.
floor and I'll push on you
Mommy.
there.
I do my back.
I should do that. Let's feel your back.
Yeah.
This side.
I just fall down. I think they can
Okay.
see.
So, any pain when I push on
No.
you? Okay. So it's just the way you were laying.
Yeah.
All right.
That was funny.
I'd like to feel for pulses. Okay? So I'd like to feel your radial. And earlier we got 60 for apical, so I am going to be checking the clock. I don't wear a watch due to I like no antimicrobials under the watch, so I just look at the clock on the wall. And again, I do get 60. And then I'm just checking for a regular rate and rhythm.
Mommy, why
And
you
that
do
is
that to
regular.
me?
He's not a baby, so I'm just looking for a breakdown, but I don't think I'll find it. I would like to feel for a posterior tibial. Can you please lift up your pants? You've got a great pulse there. I'm going to feel for a dorsal pulse, which is on your foot. Oh, excellent pulse there. I'm going to feel for a dorsal pulse over here. Excellent. And great. Good. Perfect. He's got good pulses. I'm going to assess for jugular vein distension. Lift up your neck. Turn your face that way. I see no jugular vein distension. This way, sir. I see no jugular vein distension. Okay, wonderful. So that is a normal finding, so that is good. Let's check your eyes. I have a Snelling chart. So I would like you to stand 6 feet away, which we've already measured to be right here. Right here. Read this top. Oh, cover one of your eyes. Read this top line, sir.
E, F, P, T, O, Z, L, P, E, D, P, E, C, F, D, E, D, F, C, Z, F.
You are off by one. The
La,
last
la,
letter is
la.
P. Undo that eye. Do your other eye.
T, F, P, T, O, Z, L, P, E, D, F, E, C, F, D, E, D, F, C, Z, P.
Perfect. Look with both eyes, sir.
E, F, P, T, O, Z, L, P, E, D, P, E, C, F, D, E, D, F, C, Z, F.
It is a P. So I can't say that you have 20/20 vision. I will say that you have 20/40 vision. I'll have you take a seat. Do you wear reading glasses?
Yes.
Oh, so that's why. We probably should have you
Well, but it's for closeness, not far away.
for far away.
Yeah.
All right. Well, I would suggest you check with your eye doctor again. Do you wear goggles at work?
I wear safety glasses.
You do? Okay. So I find his abdomen to be rounded, no lesions, no nodules. Hair distribution appears to be normal. Percussion. Let's look at your percussion. Go ahead and lay down again.
I don't want you to do
I
that.
find that to be normal. No pain or tenderness with light palpation, with deep palpation, no pain or tenderness, complaints of pain or distress. Bowel sounds were active in all 4 quadrants. Liver borders. I did not feel any abnormalities. And again, let's look at your shoulder. Let's see that. Could you take your shirt off? I don't feel any redness or swelling. I don't see any abnormalities. I'm going to look at the other one. And it appears just like the other one, but with a different tattoo. No redness or swelling. Any pain when I touch, sir?
No.
Okay. I would like you to stand up and I'll stand behind you. I'm going to check your hearing. I'm going to whisper.
I put my
And
shirt
you
on.
tell me, yeah, you can put your shirt on. We don't need your shirt off to assess your hearing. I'm going to whisper, and I would like you to tell me when you hear me.
Yep.
What did I say?
Bird.
Oh my God! I'm going to stand on this side of you.
Crow.
Very good. I'm going to stand on this side of you.
Crow.
Okay. Excellent. Your hearing appears to be normal. Yes, we can clap for that. You can take a seat again, sir.
I don't want to clap.
Okay, you don't have to. Tell me your name.
Scott Wayne.
Where are you?
In my house.
What time is it?
I have no clue.
Well,
maybe.
round of applause.
If I told you it was 8:45 at night.
Okay.
Actually, what's the date?
December 15th.
Very good, sir.
No.
So, it's actually the 14th. That's fine. So, let's watch you walk back and forth.
You're a grown man. Help up your head.
So you appear to have a normal gait. I will go ahead and have you take a seat. Shut your eyes. Do you feel anything?
You touching me.
Where am I touching you?
My
Speak louder.
arm.
Where am I
Ear.
touching you?
Ear. Left ear.
Where am I touching
Left
you?
arm. Left fingers. Right foot. Left foot.
All right. So you have normal sensations?
Yep.
Okay. Do you have any issues with your smell?
No.
Okay. Reflexes. Let's check your reflexes. So, sir, I'm just going to have you relax this arm, okay? I don't have a hammer. I wish I did. Okay, so just let that dangle, okay?
Because I'm not used.
Do you feel like I'm eliciting a reflex in you at all?
Whoops, I just shoved my thumb in it.
So you do feel like you have a reflex?
Yeah.
I'm going to give you 1+ for your reflexes. Okay, knee. Relax your knee, okay? Just relax it in my hand. Oh, good. I would say you have 2+ in that leg. Okay, relax your leg. Good. 2+ in that leg as well. So I'm going to say you have normal reflexes. Wonderful. One thing I do want to watch, just let me support your leg, okay? I'm going to push on it, just let your foot do whatever it does naturally. No clonus. So that's good. I would like to check your Babinski reflex. Good. Excellent. 1 default. All gold stars, sir.
Thank you.
Yep, 2+ bilaterally. All right. So I would say we are going to refer you to a neurologist for your headaches, and you feel like you have some memory loss. At the beginning of the show, I asked you, or assessment, I asked you for 3 words. Tell me what those are.
Pretzel, paperclip, and cake.
Woo! So I would say short-term memory loss is really good. I don't think you have any short-term memory loss.
this.
But we're still going to refer you to a neurologist for headaches, and because you feel you have short-term memory loss. Do you feel that your memory loss is going to impair you from doing your job?
No.
Okay. So I'm going to recommend that you pass. What do you think?
Good.
All right. What do you recommend for me?
I recommend
Should I pass?
you should pass too.
Okay. Thank you. Merry Christmas.